Hello, Constance here from Parenting Genie on our Wednesday night live stream about breastfeeding and baby wearing. Now, I hope you're all well. Anybody who's watching this live, and if you're watching the recording, I also hope that you're well. I would always love to know from where you're watching this when you do. But I would say that I predominantly talk to an Australian audience. But if I'm wrong, then please put a comment in the chat or comment section. So anyway, today I would like to discuss a little bit about medication and breastfeeding, because many breastfeeding and lactating mothers do take medication or have to take medication, and they are often very worried about the effects on the baby and how the medication affects their breast milk, and hence their baby who will get some of that medication into their system. So the first rule is that most medications are safe, and we always should say that breastfeeding and breast milk is the most nutritious food for the baby, and we should not compromise the baby by not feeding the baby. But we also need to make sure that mum is healthy if mum needs to take medication. So yeah, we talk about the 1% rule. In most cases, less than 1% of medication go and reach the breast milk. Of course, we have medication that can be what is called long-acting, and we have medication that is short-acting. We have lots of resources these days. So even as parents ourselves, we can look up medication. But we should collaborate with our doctor or our pharmacist as well. So there's three things that you need to ask your pharmacist or your doctor. You need to ask, is there a version of this medication that has a shorter half-life? Meaning that by the time your baby is due for a feed again, most of the medication has already left your breast milk and left the system fast. Is there alternatives? Can I take a cream or a spray instead of a tablet that goes through my stomach? And also, you need to ask your pharmacist and your doctor, how can it affect my baby? You want to know whether there could be extra sleepiness, whether the baby could develop a rash as a result of the medication that you need to take, or whether the baby may get a little bit of a tummy upset, which can often be the case when a mother develops mastitis and needs to go on antibiotics. The antibiotics prescribed are absolutely safe for the baby, but they will go through the breast milk, and some babies will develop some diarrhea as a result of it. So if your doctor puts you on a medication for any kind of illness and says you need to stop breastfeeding, then you need to ask questions. Because stopping breastfeeding and pumping and dumping, how it is often called, is most times not a good option, because it can lead to mastitis, and that means you may have further illnesses to deal with. So generally, I would like to just give you some examples of what is safe to take whilst you're breastfeeding. And one of the things that is been prescribed, or you can actually get it over the counter, is paracetamol, also called Panadol. So you can take that safely. It does not have any side effects on your baby. The same is with ibuprofen, which is a non-steroidal anti-inflammatory. So that can be taken for pain or also for fever, especially in a situation where you may have developed mastitis. Other medication for allergies that are safe is loratadine, or also called Claritine in the shop. That's your first option. Zyrtec is okay as well. Saline sprays are even better. So if you can cope with steam baths and salt washes in your nose, or salt sprays or salt saline, then that would even be better. In terms of antibiotics, I've already mentioned most mothers, unless you are allergic to penicillin, if you develop mastitis, you would usually get a medication called flucloxacillin or amoxicillin, and they are safe to take with your baby, but you may find that your baby does develop a little bit of diarrhea and maybe a little bit of a stomach upset. So what you need to be cautious with is high doses of aspirin. So if you need to take aspirin, it has to be less than 150 milligrams. And you also need to be very cautious with codeine. So codeine is something that can make your baby sleepy, and you can't use that. Another medication that you can find quite often over the counter, cold and flu tablets, they have something that is called pseudoephedrine in it. Now, that could be very contraindicated because it can reduce your milk supply. It could even dry it up, and it could also be irreversible. So that's something to stay away from. If you do need to go on antibiotics, you need to finish the course. So don't stop the course just because your baby has a little bit of diarrhea, because you could have issues with your mastitis being prolonged, or you could also develop an abscess or so. So always finish the course first. For issues with diarrhea or with constipation, you can use stool softeners, but if you use laxatives like senna, you may find that your baby is going to develop diarrhea from that as well. So there are just a few examples, and I am going to give you a few ideas of what you can look up yourself. So there is very trusted resources. One is called LactMed, and you can type that in your Google or in your search engine, and you have a free database, and you can put in the medication that you are on, and it will give you a lot of answers on whether it's okay to take or not. There's also an app that's called Infant Risk Center. It's American, but it's also very, very useful to have if there is medication that you need to take and you haven't got anybody to talk to. And then there's another American website. It's called mothertobaby.org. Here in Melbourne, we are very, very fortunate. We've got the Royal Women's Hospital, and they do have a special phone line for parents to inquire about medication and speak to a pharmacist. We also have the Monash Medical Center. That's another campus, and they have a fantastic pharmacist who will also be able to speak to parents about medication safety whilst breastfeeding. And so they're the sort of things that you can look up and you can do. I haven't gone into any particular medicine in terms of herbal preparations. I may be doing that next week or the week after. Some things that come to my mind whilst I'm talking to you is gargle for a sore throat. Make sure that it's got no iodine in it, because the iodine can affect your thyroid function and your baby's thyroid function. And you can get iodine gargles for sore throat even over the counter or in the supermarket here. So just do not use it. Other things, and I've done some live stream in regards to contraceptive, I think. And so, yeah, be cautious with the combined pill until you have got a really good established milk supply. And even with the progesterone-only pill or the mini pill, it's best to use or start using when you've got a well-established milk supply. But again, you can look these things up and discuss it with your doctor or with your pharmacist. So, yeah, so there are a few of the things. I won't be going into any other drugs in terms of recreational drugs at this point in time tonight. I won't be talking about alcohol tonight either, or nicotine. That will be for another session. So I just wanted to let you know that most medication is safe, because only 1% or less will enter the breast milk, and that it is more important for the baby to have your breast milk, even with a little bit, like less than 1% of your medication in the breast milk. And just reviewing a few things that I've on my cheat sheet here. So eye drops. If you need to use eye drops for allergy or hay fever because you're sneezing and you're terribly suffering with, best of course would always be to avoid the pollen and the allergens. But if you need to use eye drops, and even if the eye drops have got some cortisone in it, sometimes they do, because your eyes are so affected by it, and even with nasal spray. But with eye drops, what you do is you put the eye drops in, and then you actually hold for a little while until the eye drops have worked, just at the outside of your tear duct. And what you do then is you take the rest, whatever hasn't actually gone into your eye, you just wipe that off with a little bit of a cotton wool bud or something like that. So yeah, what else do I need to talk to you about? I'm just going to go through it. So cough suppressants are considered safe whilst breastfeeding. We've already talked about nasal symptoms, so be careful with the decongestants that have pseudoephedrine in it. Oh, back to the nasal sprays. Yeah, so corticosteroid nasal sprays containing cortisone or beclomethasone are considered safe to use during breastfeeding. Decongestant nasal sprays containing these things may be used if corticosteroid and antihistamine nasal sprays have not relieved your symptoms. So just be aware of that. Always try something without cortisone first. Okay, so I wish I could get questions from you, and you could ask me questions and I could answer them for you. But I think that is probably most of what I would like to talk to you about. Okay, there's one thing that some mothers can be quite prone to after they've had a baby, and that is thrush. So a thrush medication is safe as well. So it could be even nipple thrush, where you would be getting a script for some Nilstat for you and for your baby. And even if it's a vaginal thrush and you have to take tablets or creams, all that is considered safe whilst you're breastfeeding. And yeah, I think I can probably wrap it up and say, continue breastfeeding, look up those websites, talk to your pharmacist, talk to your doctor, make sure that you ask questions. Never believe that you cannot continue breastfeeding when you put on a medication. Ask for alternatives. if there is an issue, and otherwise be safe and enjoy your baby. So I hope that gives you a little bit of time to think, and I'll see you next Wednesday, same time. So far, we don't have daylight saving finished. I'm not quite sure when that is. Okay, thanks for listening, everybody, and talk soon. Bye for now.